Hello, good evening, Chair Harrington and board. We do have quite a bit to cover tonight, but I also know that you're really probably tired of being on Zoom today.
Don't rush it. This is really important.
Yeah, I won't rush it, but we'll try to get through it for you. So, okay, next slide, please. So as normal, I'm starting with the numbers. I'll go pretty quickly on this because we all know that the numbers are going in the wrong direction. As of yesterday, our state had reported cumulative 57,646 cases of COVID-19. That puts us at a case rate statewide of 1,297, almost 1,300 per 100,000, with 765 deaths and an increasing hospitalization rate. I believe last week when I talked to you, the 7-day average was 12, and we're up to 23 now. Next slide, please. So these are our Washington County numbers, and what I really want to point out here is that you'll see from November 2nd to this week, we've seen a 27% increase just in 1 week of cases. And a couple of late breaking points I want to make, and we can move to the next slide because you can see the numbers there. I think this is really stark. You've seen this slide before. This is what we refer to as our epi curve or epidemiologic curve. But what goes along with this is a couple of things that I want you to know. So one is the healthcare system is starting to struggle, and that includes our emergency medical system of care. What we've learned in the last week is that they're struggling with especially non-emergency ambulance, so not the 911 ambulances, but non-emergency. Those are the vehicles that take people from maybe the hospital to a long-term care center or to a doctor's appointment when they need that medical transportation. And this is happening across the region. And so we're working with Multnomah County in particular to look at how we can reduce some of the staffing requirements, because right now there's a requirement that the ambulance must be staffed with a licensed to practice EMT level. And so we're looking to be able to reduce that maybe to basic first aid. The other thing is that we're hearing today, this is just from today, that the metro region only had a small number of open ICU beds. All the major healthcare providers are at maximum capacity for testing as well, and testing results are now being delayed 5 to 7 days, which we've talked an awful lot about how difficult that makes our job in finding cases early and getting people isolated and quarantined. So those are a couple of late breaking pieces of data that I wanted to share with you that have happened since doing these slides. So next slide. So the other thing that I wanted to just bring back to your attention, I know we've talked about this a lot since March, actually, but we do continue to see a disproportionate impact of COVID-19 on our Latinx population. And just as a reminder, this disproportionate impact and the cost of lives and quality of life for racially and ethnically diverse communities from COVID-19 is really serving as a tragic and reoccurring reminder of the long-standing inequities that exist in times of emergency. It exists all of the time, and in particular in times of emergency and crisis. This is evidenced across the nation, where non-white residents have suffered significantly higher rates of illness, hospitalization, and death. And our experience in Washington County, as you can see, is mirrored in these national trends. This reaffirms that understanding that these populations remain especially impacted and vulnerable in the times of crisis, and brings to light the structural inequalities and challenges such as access to healthcare, education, food, and housing. What we're finding is these populations are really struggling. They can't stay home and stay safe like many of us can. They can't do their jobs on Zoom or by telecommuting. They're the folks that are really making sure that we have food on our table. They're often taking care of our parents and our grandparents in assisted living situations, working in factories and other businesses that really have difficulty social distancing and not being able to stay home. So I just wanted to remind you of that disparity. Next slide. So what are we doing to address this impact? And you can see, and we sent a communication update today, and we'll be sending that weekly again. But we were, as you remember, the first county to announce this disparity and start working on culturally sensitive material. We worked with Salud, Centro Cultural, we worked with Virginia Garcia, made visits out to the camps during the migrant season, really worked with those community-based organizations to transcreate Spanish language material, Facebook material, created a coronavirus webpage, made visits. We can go to the next slide. Really tailoring the messages. We did hire some culturally competent contractors to produce social media messages, graphics, and videos. So, such as the contact tracing video was created in Spanish so that we could help our Spanish language community members understand, well, what happens when you're called and how does contact tracing work. Also, we've hired some experts in social media to help us with Facebook Live interviews and memes and social broadcasting campaigns that have reached over 2 million Spanish speakers. And then finally, next slide. We also have been working hard to address the essential needs. So especially for folks that are in isolation or quarantine, really helping to assure that they had their rents, utility paid, that there were groceries for family members, and that they were well supported in isolation and quarantine. For other folks, we often, when we were delivering educational material and masks, we also delivered food and other incentives to really help the community come together and talk about what was happening. And a lot of that was done in partnership, again, with our culturally specific CBOs in this area. And then just as a reminder that over 80% of our disease investigators and contact tracers are bilingual, and 65% speak Spanish. So just as a reminder that we, OPHI did a great job of helping us to find bilingual, bicultural staff, and that's mostly Spanish speaking, but many other cultures as well. Okay, so moving on. I really had hoped by tonight to have a graphic that really helped to show what the new metrics are going to be. But the governor's office and OHA are working on new metrics that will replace the phase 2 readiness and the watch list. So you might have noticed in my data slides that we didn't have the phase 2 readiness or the watch list slides, and that's because they're being replaced and because you would have seen a lot of red, and that just makes us sad, even though it's the truth. So what we think is going to be helpful in these new metrics is that they're aligned with the school metrics. So for example, Washington County would be in what they call the extreme risk category right now, which is 200 or 200 cases per 100,000 or higher. And we've been there for the last week. And we also think that these metrics are going to be, so they're related to both disease rates, like I just said, 200 per 100,000 is the extreme risk, and then they're titrated down. And it matches what you see in the school, in-person school metrics. And then also continuing to look at testing and test positivity. So we think that these metrics will be more helpful in helping us to make informed community decisions about how we can behave and what businesses can be opened. So the other thing is that we've had to make some changes in our public health communication to really help people to understand and amplify the governor's message around what this freeze means. So providing some stay-at-home information, really asking people to avoid any unessential, unnecessary trips. So other than work, healthcare, grocery stores, really asking people to avoid trips and limiting social gathering to 6 or fewer and no more than 2 households. And we know that this is incredibly difficult, especially as we approach Thanksgiving. But I think it's important to remember Thanksgiving is important of a tradition that is for many of us and many of our families. It's one day, and having a healthy family can last many, 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 many years to come. And so we're asking you to make this sacrifice this year and really think about safe Thanksgiving plans, which we'll talk a little bit more about in a minute. Also, the governor ordered food as back to curbside takeout only. Indoor, outdoor dining is closed and gyms are closed. People are asked, everyone is asked, and I think I've been saying this for a few months. If you're outside of your house, please wear a mask if you cannot maintain complete and total 6-foot distance. But the governor's now ordered that when we're indoors or outdoors, if we're around others, we need to wear a mask. Then the other important message, public health, even in Washington County, we're seeing over 100 new cases per day. And so we have had to change our approach, especially in the metro area. So Washington County and Multnomah County in particular, and Clackamas County, we just are over capacity. Testing and results are taking longer. So we're just asking people, if you're waiting on test results, just stay home. Please stay home. If you test positive, don't wait for us to call. Isolate yourself from others and stay home, and take steps to prevent transmission in your own home. And we do have videos both in English and Spanish on our webpage to help with that. And then we're asking folks to please notify your close contacts and ask them to self-quarantine. We all know what to do now. If we test positive, we need to isolate ourselves. We need to stay home. We need to protect others in our household, our friends, and our coworkers. And we need to let people know right away, because the public health system is over capacity and you may not get that call soon. So go ahead and do what we've been talking about all these months. Okay, so the next slide, please. So higher caseloads have changed our priorities. I've talked a little bit about this. We are going to have to focus on the most high priority, high risk outbreaks. So, for example, outbreaks in assisted living nursing homes. We're also going to have to prioritize all the assistance that we give to high risk facilities like long-term care, congregate housing, jails, shelters, manufacturing, and processing. Those are the businesses where we're seeing the most risk. We're going to end daily monitor to free up case interviewers and contact tracers for those highest risk cases. And we're going to refer lower risk individuals and work settings to the 211 system for general education and support. So we will not be notifying all work sites anymore if there's a case identified in their work site, unless it's high risk, such as I've mentioned, the long-term care congregate setting or high risk settings. Okay, so the new school metrics, and mostly I just wanted to remind you of what the metrics are. Washington County is in that red, distance learning. Our case rate is higher than 200 per 100,000. And our testing, as you saw, is also high. But what's kind of also nice about this is these metrics are going to match some of the new metrics that OHA is working on that will help guide total reopening for our county. So next slide, just to show you where we are. And as you can see, our Washington County, our case rate is currently 260. So that's quite a jump from the 189, which was when we were first put in the 2-week pause before the governor's freeze order. And you can see that we also, our test positivity is above that 10%. Clackamas County is in really the same place as us, as well as Multnomah County. So I think that, you know, you've heard us say that we do anticipate that our freeze is, with numbers like this, case rates this high, are likely to last more than the 2 weeks. Okay, next slide. So just also wanted to let you know, this is probably not a surprise, but we've had a 50% increase in the past week in families that we're supporting in isolation and quarantine. We've supported over 1,685 families, households. In just the past week, we had 163 households that we've been supporting in isolation and quarantine. And the way that we do that is really strong partnerships with our community-based organizations. So you can see Centro Cultural, Familias en Ascensión, ERCO, and 20 other community-based organizations have contracts and agreements with Washington County and with the Oregon Health Authority to really help us to support these families. Because again, when the entire family is under isolation or quarantine orders, people aren't working, it's difficult to pay rent, to get food, utilities, all of those essential needs need to be met. And we need to check in on them, see how they're doing emotionally, physically, help them get to doctor's offices if they need to do that, or contact with their doctor if they need to do that. Okay. So I went over this a bit earlier, but this is really the full list of what's required in the governor's new freeze order. I'm not going to read this. This is available for the public on our website. You all have seen this multiple times, and it'll be available up on this presentation that folks can get through the packet that's online. But I just wanted to have it all there in case we want it to be wherever people go and look, that they're able to find this. So if they look for it on this packet, if they look for it on our webpage, on the county webpage, that they'll be able to find what these new orders are. The other thing that got a little bit, next slide please, that was a little bit more quiet, I think, because of the freeze orders is the governor, along with the governors of California and Washington State, have ordered a 14-day self-quarantine when you're entering their state from another state or an international visit. And so what that means is if it's non-essential travel, that they're asking you to self-quarantine for 14 days when you return. It does not include essential business or health travel. So for example, if you live in Vancouver and you work in Washington County and you're not able to telecommute, you can come back and forth to work, just as an example. But it really is trying to get people, again, to avoid non-essential business or social traveling. Okay, and then just quick updates on our programs. So there was a problem with the HMIS system on Monday and Tuesday, and so I don't have numbers for you, but we do still have Family Promise operating and sheltering folks in hotels. The Safe Sleeping Village, we've now transferred everyone from there to either winter shelters or to the respite center. The RV camping, RV safe sleeping village is still operating. And the great news is that our winter shelters have opened. They opened on Monday, and just that quick, just on Monday, the 4 shelter sites were near capacity, which is 120 beds, and we already have 30 people on waiting lists. So still a great need out there. Next slide. The respite shelter, we still have the 36 folks that I talked about from the Safe Sleeping Village on the what we're calling the west wing of the respite shelter. And then we do have 5 COVID impacted individuals on the east wing of the COVID respite shelter. Next slide. Childcare and school age learning. So we've now had 291 applications that have been completed, 318 awards, and we have awarded $3.18 million to our childcare providers, which is great, and applications continue to come in. And the good news for the school districts is all the school districts, as I've been reporting, are participating. And I think that the latest information this week is that they all anticipate spending the full approved amount because there's great need out there and they're doing really good work. So we're excited about parents being able to access that support. All right, Thanksgiving. This is a sad topic for many of us, but again, you know, please think about it as really an opportunity to take care of the people that you love and to keep them safe and healthy. So we're asking people to only share meals with people in your immediate household. I did see that Zoom, which we're using tonight, has on Thanksgiving Day extended that they won't keep people to that 40-minute limit. So that's a great opportunity. I'm gonna Zoom my family in Arizona. I don't think I'll do 40 minutes because I'm not sure I could do that, but definitely it'll be an opportunity to pass that laptop and tablet around and say hello to my parents and my brothers and sisters and nieces. It'll be serial Zooms because they're all having their own household events. So I'll have to make multiple calls this year. But also just in general, limit social gatherings to no more than 6 people for no more than 2 households. And really asking people, if you do have a second household for Thanksgiving or for any other gatherings, that if you're indoors, to please ask people, even though you're family, wear your mask when you're indoors. And as hard as it is, we know Black Friday and all those shopping traditions are coming up, but really, really important to avoid crowded malls and consider shopping online. And I keep thinking about, maybe I don't need to show this, but these activities, we had some good news this week about vaccines, and the horizon looks really great, that there's some effective vaccines on our near horizon. But to get us there, we need to keep doing these things. And we might even want to think about doubling down on these. If you haven't done it already, please get your flu shot. And we've stressed this over and over and over, wear your face covering. It is, you know, for some people, it's annoying. They don't want to do it. But let me tell you, as a nurse, it's been a long, long time since I worked in a hospital, but it is also really, really uncomfortable and annoying to be on a ventilator or to be in the intensive care unit. So I'm asking you, please avoid that for yourself and your family. Wear that face covering when you're with other people. Maintain that physical distance. We always tell you to wash your hands in public health. And again, avoid those big social gatherings.